It is generally believed that topical retinoid should be applied in the night, otherwise it'll darken the skin. However, topical retinoid is not photosensitive. It does not darken the skin. The reason why it is recommended to apply topical retinoid in the night is that Gen 1 retinoid becomes unstable when exposed in sunlight and deteriorates easily. However, Gen 3 retinoids and the current Gen 4 retinoids, Aklief, do not have this problem anymore. The chemical structures are stable when exposed to sunlight and do not deteriorate. Therefore, they can be applied during the daytime. Hello, I'm Dr. Lin, a dermatologist in Taiwan. Last Sunday, there was a launch symposium of Taiwan's Gen 4 retinoid, Aklief. Many acne specialists and experts from overseas, as well as several domestic doctors in Taiwan, delivered different topics. I was one of the hosts. Dr. Yang in our clinic also shared our application experience. This launch symposium, including online and offline, has hosted a total of approximately 300 dermatologists in Taiwan. That's about 1/3 of all dermatologists in Taiwan. During the symposium, it showed the development process from Gen 1 retinoid 50 years ago to the current Gen 4 retinoid. The symposium, including the later QA part, lasted for over 5 hours, with a lot of content. For those commonly asked questions, I've made a summary here. I hope it can be helpful for you all. Previously, Dr. Yang mentioned the working principle of the new topical retinoid of Generation 4, which is Aklief. So we will not cover it here anymore. Everyone can review it on your own. There, Aklief, in addition to treating pimples and come-downs on the face, it also has a few other advantages that you may want to hear about. The first one is its effect on post-inflammatory pigmentation of pimple. The lightening effect of Aklief for acne pigmentation, when compared with retinoids of previous generations, is faster. The second one is for atrophic acne scar or newly formed mild to moderate pockmarks. Aklief application has also shown improvement. This is very helpful to prevent pockmarks, because you only need to spend less money to save thousands of dollars for future laser acne scar treatment, which may even not completely remove the acne scars. It is quite cost-effective. The third one is for truncal acne. In the past, people mainly focus on treating pimples on the face. However, truncal acne is also very common, but rarely gains attention. The main reason to this is that the body is usually covered by our clothes, and thus truncal acne can hardly be observed by doctors. Or, for some people, although they are aware of pimples on their chest and back, but are embarrassed to show them to the doctor, especially that eventually leads to hypertrophic scars or even keloids. Therefore, Aklief has pretty good effect on truncal acne. Based on our own clinical experiences, we've also seen considerable improvement in our patients. Next, we'll talk about the irritation issue of Aklief. Although Aklief is very effective for acne, similar to other topical retinoids, it can be somehow irritating for new users, including redness, dryness, desquamation, and even burning and tingling sensation. We call it retinoid dermatitis. It happens to about 12% of the users, which is not low. For some patients, these symptoms appear to be mild, while for some patients, these symptoms can be significant. Other than the nature of topical retinoids, these symptoms may also be related to incorrect application method or the sensitive skin of the patients themselves. Once redness and desquamation occurs, patients will not be able to continue using it, thus affecting the overall efficacy. Next, I'll summarize some methods to reduce retinoid irritation, shared by domestic and international lecturers. The first one is to apply it focally first. You can focus on pimples and come-downs first, and just apply a very tiny amount in them, leaving other normal skin untouched. After 1 week, when you get used to it, you can gradually expand the area for the drug application. And after 1 more week, you can further expand the application area more again. Keep doing this for about 1 month. Your skin will get used to it gradually, without experiencing severe irritation state. The second one is to reduce the application frequency, a method mentioned by the international acne expert Jerry Chan. In the first week of application, just use Aklief twice a week. For example, Monday and Thursday, or Tuesday and Friday, or Wednesday and Saturday. Then, in the second week, change to 4 times a week. For example, Monday, Wednesday, Friday, and Sunday. Then in the third week, change to daily use. This routine can also effectively reduce irritation. The third one is called short contact therapy. This method is mentioned by some foreign lecturers. The short contact therapy means that 30 to 60 minutes before bedtime, apply Aklief lightly on the face, and after 30 to 60 minutes, wash it away. Then, apply moisturizing cream and go to sleep. Keep doing this for a week. Your skin will be getting used to it. Then, extend the application time to 1 to 2 hours before you wash it away, based on your own skin quality and condition, as well as the reaction of your skin to Aklief. Every week, you may increase the application time by 30 to 60 minutes. Try this routine until you can apply it at supper time around 6 p.m. and wash it away before bed at around 10 to 11 p.m. If you can have 4 to 5 hours of application time without irritation, you can apply it before bed and wash it away the next morning. This progressive application method will allow the skin to gradually get used to it and reduce irritation from Aklief. The fourth one is pressing method. First, put some Aklief cream on your palm. apply it separately on 6 to 8 spots on the face, and spread it evenly. In this way, you can avoid skin irritation caused by over-application of Aklief. The fifth is called sandwich method, shared by Professor Jerry Chen. In the night, after washing your face, apply a thin layer of moisturizing cream. Then, apply Aklief, followed by another layer of moisturizing cream. In this way, the effective Aklief is between 2 layers of cream, like a sandwich. That's why it's called sandwich method. If your skin has relatively good tolerability after applying the first layer of cream and the second layer of Aklief, you don't need to apply the third layer of cream. This is called open sandwich method, or open sandwich. Nevertheless, regardless of 2-layer or 3-layer sandwich, since the medication is applied after the cream, the medication is blocked by the cream layer. There will be less medication entering the skin, this reducing the effect by a certain degree. As a result, if you have oily skin with good tolerability, you can apply Aklief first, followed by the moisturizing cream. In this way, Aklief can directly enter the skin with better effect. It means the application method depends on your skin quality and condition, so it's better to consult your dermatologist who knows you better. The sixth one is dilution. It is generally recommended to mix Aklief and moisturizing cream with a 1:1 ratio, then apply on the face to reduce irritation. However, the premise of this method is the 2 materials to be mixed together need to have similar textures. Since Aklief is a cream, if your moisturizer is a gel or an ointment like Vaseline, then it cannot be evenly mixed with the Aklief cream. In the vehicle of Aklief, there's an emulsifier called Zemugol 6-OOPHA. If you mix Aklief with moisturizing cream redness, manufactured by the same company, you have better overall mixing effect. For people with sensitive skin, it's better to combine these previously mentioned methods to reduce irritation. The official dosage recommendation of Aklief is to press once for the face and to press twice for the body. However, it is safer to still adjust the dosage based on your own condition. Now, let's talk about frequently asked questions by patients. The first question is desquamation necessary when you are using topical retinoid? Many people believe that topical retinoid is only effective when desquamation takes place, or the more severe desquamation. Truly, although redness and desquamation is common in early stages of application, if you continue using topical retinoid, the skin will develop tolerance with less and less erythema and less desquamation. However, in my daily practice, I do have seen patients who use topical retinoic acid or topical retinol had severe erythema and desquamation, had insisted continence use. They eventually turned to have sensitive skin. When using topical retinoic acid or retinol, if you have gotten through desquamation and erythema stage successfully, it's great. But if you have been uncomfortable, then don't push it. Please take a break and do more moisturizing. Once the skin condition is better, try it again. It is safer this way. Hence, when first start using Aklief, use reduced amount or diluted application, although the effect may be reduced. The effect of topical retinoic acid or retinol are mainly seen after long-term continuous use, not after 1 to 2 days or 1 to 2 weeks. It usually takes 6 months or even 1 year to show its effect. You should not regard them as a rapid, pimple-removing medication. Using Aklief in a mild and progressive manner to allow the skin to get used to it gradually, without discomfort and side effects, is my recommended method. After all, it's a long run. Whether there are side effects, such as redness and desquamation, is irrelevant with its long-term effect. The second question is, can it be used during the day? This question has been covered in details by Dr. Chui. It is generally believed that topical retinoid should be applied in the night, otherwise it'll darken the skin. However, topical retinoid is not photosensitive. It does not darken the skin. The reason why it is recommended to apply topical retinoid in the night is that Gen 1 retinoid becomes unstable when exposed in sunlight and deteriorates easily. However, from Gen 3 retinoid to the current Gen 4 retinoid, Aklief does not have this problem anymore. The chemical structure is still stable when exposed to sunlight and do not deteriorate. Thus, in fact, you can use it during the daytime. The third question is, should I stop using topical retinoid before laser or peeling treatment? If you have been using topical retinoid for a long period of time and your skin has adapted to it, you don't need to stop using topical retinoid before laser or peeling treatment. However, if you are a new user of topical retinoids of any generation, and your skin is becoming red, desquamated and dry, I suggest you stop using it for 3 days and do more moisturizing. After these symptoms are relieved, you can do laser and peeling treatment again. It would be safer. The fourth question is, can it be used in kids? In Taiwan, the TFDA-approved age to use Aklief is 12 and above. The FDA-approved in the US is 9-year-old or older, probably due to the westernization of our dietary habit. Kids are getting pimples at younger and younger age. On the other hand, nowadays, parents are aware that prevention is better than treatment. As a result, I suggest that for kids entering grade 7 who have shown signs of pimples and countdowns, or their parents had acne at their younger ages, or even have acne scars, I recommend start using Aklief to reduce the chance of acne. Moreover, even if they eventually have acne, the severity of acne would be reduced to avoid acne scars. The fifth question is, when should I stop using Aklief? Some patients may ask, when should I stop using Aklief? In fact, if you are prone to have acne, Whether you have used conventional antibiotics or oral isotretinoin, after the pimples are gone, I suggest long-term continuous use of Aklief, as shown in our previous video. Pimples are derived from condom, and condoms come from microcondoms, which cannot be witnessed by naked eyes and can only be observed under microscopy. These microcondoms, under certain circumstances, such as late sleep, female's menstrual period, or eating fried food, may break out as pimples. Therefore, it's very important to exert daily metabolism of these microcondoms. To sum up, it's okay for long-term use of Aklief. Can oral isotretinoin be replaced by Aklief? Of course not. Oral isotretinoin is currently the most effective medication to treat pimples of all degrees. When taking oral isotretinoin, it's okay to combine with Aklief to further reduce the possibility of pigmentary or atrophic acne scars. However, when you are taking oral isotretinoin, your face may become drier. Therefore, Aklief should be applied with great caution to avoid further desquamation in the future. I'll share contents about different topical anti-acne medications, including antibiotics, azelaic acid, Acridual forte previously mentioned, as well as Aklief I introduced today. I will give you a full analysis of how to choose correct medication. Please give a like to our video, subscribe to our channel, and switch on the little bell on the low right corner. See you next time.
痘痘的外用药膏，报告抗生素。